Hello everyone, Nurse Grace here, and today we are going to talk about developmental coordination disorder. Developmental coordination disorder is a type of motor skill disorder. And first, you're going to talk about the diagnostic criteria of developmental coordination disorder. First diagnostic criteria is the acquisition and execution of motor skills is substantially below the chronological age, things like catching objects, scissors, and cutlery. What is the next diagnostic criteria of developmental coordination disorder? The next diagnostic criteria is motor skills deficit significantly and persistently interferes with activities of daily living, such as self-care and self-maintenance. Another diagnostic criteria is onset of symptoms is in early developmental period. That's why it's part of the neurodevelopmental period, a set of conditions that are diagnosed basically during childhood and during developmental. And the last diagnostic criteria is the motor deficit are not attributed to neurological condition that affect movement. Conditions like cerebral palsy, muscular dystrophy, and degenerative disorder. And next, we're going to talk about risk factors. When we talk about risk factors, that we'll talk about environment. When we talk about environment, we'll talk about the environment that the infant or the baby grew in. So when a baby is born with low birth weight or before time, like premature birth, that is a risk factor that of developmental coordination disorder. The next one is genetic and physiological. When you have a family history of developmental coordination disorder, then the baby is prone or a child is prone to developmental coordination disorder. Another risk factor is cause modifiers. When we talk about cause modifiers, we will say that individuals with ADHD and developmental coordination disorder demonstrate more impairment than individuals with ADHD, that is attention deficit hyperactivity disorder, without developmental coordination disorder. And next, we'll talk about the key features. Key features are basically the features that a child or a patient will present with before we decide that this person has developmental coordination disorder. Part of the diagnostic criteria, but this is how we will tell. One of the key features is delayed motor skills. When we talk about delayed motor skills, is children with developmental coordination disorder often struggles with activities that involve the use of fine motor skills and gross motor skills coordination. Another one is clumsiness, frequent tripping, dropping, and dropping objects, and poor balance are common with people with developmental coordination disorder. Another key feature is difficulty with handwriting. Difficulty with handwriting. These people will always have a problem. They will write slowly. They will have bad handwriting. They'll need assistive objects to help them write. Challenges with daily activities. When we talk about challenges with daily activity, we basically talk about activities like dressing up, buttoning their shirts, and riding a bike can be very frustrating to people with DCD, that is developmental coordination disorder. Another problem is problem with sports. They'll have a problem with catching, kicking, and throwing a ball. So the next thing we'll talk about is the diagnosis. The people that should diagnose developmental coordination disorder is basically a pediatrician or an occupational therapist. And before they diagnose, they'll have to do a proper clinical history of motor difficulty and standardized motor skill assessment. You have to assess the motor skill to rule out conditions like cerebral palsy and muscular dystrophy. Now, what do we do? Well, we need to talk about the management of people and kids with developmental coordination disorder. They'll need occupational therapy. When we talk about occupational therapy will help with fine motor skills and gross motor skills. And then they will need physical therapy. When we talk about physical therapy, these people will need help on focusing and improving skills of daily activities. Then we will need adaptive strategies using modified tools. They'll need to use what are the they need to use pens and shoes that will help them. For the pens will help them with their handwriting, and shoes will help them with the tripping, so that they'll not be frustrated during these activities. Another one is encouraging physical activities like swimming and martial arts. This one will this one improves their confidence when it comes to movement, especially swimming. When you swim, you use some muscles in your body, and they will be stronger with them, as well as your motor and gross skills. Then we'll need school support. When we talk about school support, teachers may provide extra time when these people are performing a specific task. They'll need as extra time and assistive technology that will help them. So I'll ask you one thing: is what have you learned or about fine motor skills, or what is your experience with people with the developmental coordination disorder? Write down on the comment section. Don't forget to subscribe and like this video. Bye. We'll meet in the next when we talk about another condition. Bye and subscribe.